Hello, YouTube world. It's Miss Patty with For Your CNA, and welcome to today's episode of the live question and answer session for CNAs. And as always, I'm Miss Patty. Thank you guys for joining us. While you filter in, when you come in, give me a quick hi. Let me know you're here. I'm just going to get my screen set up here. So give me just a second. And we'll get started. I know so much to do when I first start here. There we go. All right. So now I can see you guys. Let me bring this over here so I can see your comments. All right. So a lot of things happening today in the world. A lot of very troubling things. We'll see how this all shakes out. The world is definitely going through some growing pains. Hi, Jennifer. Hi, Jennifer. I've been glued to the news today. I don't know if you know what's going on, but it's something to keep an eye on. Thankfully, the need for CNAs is going to continue indefinitely. So we are in a good industry, very good industry, and having the ability to help others is always a good thing. So let me tell you. Oh, thank you, Jennifer. I look forward to this too. This is my fun time. So let me talk to you today about something. I had actually written this down to talk about a couple of days ago. Hi, Tiffany. Welcome. This is something I actually talk about in my class. Hi, Julie. Hi, Lofania. Hi, Will. So this is something that I talk about in my class, and it's called the bucket of nice. And I know that kind of sounds weird, so let me explain. So this is my theory, okay? This is all me, 100% my theory, okay? But I believe everybody is born with a bucket of nice. You've got all of your nice in one little bucket, and throughout your life, you give nice out and your bucket gets refilled by other people. So your bucket of nice is always moving. It's getting emptied and filled and emptied and filled, and the levels always going up and down. But overall, I mean, throughout your lifetime, you usually have enough nice in your bucket that you can give some out to people in need. Well, I don't believe that everybody gets their bucket filled on a regular basis. So I want you to imagine an actual physical bucket filled with nice. And somebody takes all of that nice out and just hands it away and gives it to everybody they see. They hold open doors at the grocery store. They give to their local charities. They help neighbors and friends, and they're just constantly giving out their bucket of nice. And eventually, if nobody else is filling it up, if they're giving it all away and nobody's putting more in the bucket, we can figure out pretty quick that that bucket level is going to decrease, right? So as we get older and we don't have a lot of interaction opportunities with people, right? So the elderly tend to be a lot more isolated. Their energy levels drop, so they don't get out as much. Their families are busy, so they may not visit as much. So the level in that bucket is going to drop and drop and drop and drop and drop and drop. And before you know it, the bucket has run dry. Now, these people generally end up in our facilities, right? So they've gone through a hospitalization, they got sick, they can't return home. They're now in our nursing home or our assisted living facility, and they've lost everything. They lost their home because it had to be sold for their medical care. They lost their independence because now they're here. They probably lost their pets. They lost their possessions because when you move into a facility, you can only bring 2 suitcases full of stuff, right? So they've lost everything. And here they are in our facility, and we walk in and we expect them to be nice. Why? Their bucket is empty. It's been empty long time ago, and they've experienced a tremendous loss in their life. They're grieving, and we get upset if they aren't nice. Well, they have nothing to give you. Their bucket is empty. So if you want patients to be nice, you first have to fill their bucket. They have to have something to work with. They can't hand out nice if they don't have any. So the best way to help your relationship with patients become that relationship that you want, that nice give and take, that compassion, is to make sure that you're first providing it. So, and I hear CNAs say this a lot. Well, she started it, or he's not a nice person. Why should I be nice to him? Or I don't go into that room very often because that guy's a real jerk. Well, maybe that's because their bucket is empty. And we can't expect nice from somebody with an empty bucket. So, with those patients, I always go out of my way to find those patients whose buckets are empty and do everything I can to fill those buckets. So, an extra smile, a pat on the shoulder, maybe some conversation if I've got a few minutes. Maybe I can find something that they're interested in. If they liked puzzles, maybe putting a puzzle together with them and just taking that time to refill their bucket a little bit. Now, understand that buckets can't be filled in one encounter. You can't do, there's just not enough stuff to put in that bucket to keep them going for a long time. So a lot of times when you've got these grumpy, irritable, mean patients, it's going to take a concerted effort on your part. You're really going to have to give them a lot of nice over and over and over and over and over again so that you refill that bucket so that they've got something to work with. Right? Because it has to kind of, first, that nice has to kind of fill those little holes in their soul and then fill up their bucket. So it's really, it's really helpful if you find those ones that really need that little bit of extra care. If you've got a really mean patient, don't avoid them. Think to yourself, their bucket is empty. Maybe they need it refilled, and be that kind presence in their life rather than just being mean back to them or avoiding them or and it's been my experience that the more people have taken out of them throughout their life, right, the emptier their bucket gets. So if you've got somebody that lived a very abusive lifestyle, that they were horribly abused by maybe their spouse or their parents, or maybe they were in a situation that took a lot out of them emotionally. It may take a lot of kind and nice to overcome that and to get nice back from them. But those are the ones that really truly need our help the most. Not just physical care, but that emotional care, that healing balm, if you will, that little bit of extra nice that you can give them. It's not, being a CNA is not just about ambulating and mouth care and peri-care and partial bed bath. Being a CNA is also about healing that emotional part of the patient that maybe just needs a kind word, a smile, a memory that they like grape jelly, not strawberry. Those little things go a long way. So hopefully I can challenge you to give somebody this week a little bit of nice when you know they need it the most. So I hope that kind of stays with you. So let's see here. Who's here? Hello, Carol. Hello, Emanuela. Hello, Eunice. Hi, Stella. Jennifer says, this is like church to me. I love it. Look forward to it every week. Well, thank you so much. That is awesome. Marley says, hello. Simonis says, hi. And Jennifer has a question. I get the difference between CNA and caregiver is caregiver does good neighbor and CNA does nursing. Why are we state tested on feeding, ambulating, and dressing? That's good neighbor care. Absolutely. But if you remember last week, Jennifer, I said that caregiver is personal care. So that's feeding, dressing, grooming. You got all that good neighbor stuff. Good memory there. So we got the good neighbor. And then CNA is good neighbor plus, right? So when as a CNA, right? So good neighbor, if they don't brush your teeth right, well, they're a good neighbor. They did the best they could, right? But when we get up to the CNA level, we have to remember that we are expected to act professionally because now we're certified. So it's no longer good neighbor. Good neighbor can kind of get away with some stuff because they're a good neighbor. CNA, there's an expectation there of knowledge, of competence, of level of ability. And that's why you're graded on those personal care skills, because even though CNA is moving into that nursing arena, that observation and reporting, we are still responsible for performing those personal care skills to give us the opportunity to observe. So I hope that helps you. Let's see here. Anyone can ambulate someone to a wheelchair, get them dressed, or feed them. CNAs are trained for that. And that is something anyone can do. That's why I'm confused. And Jennifer, you're right to a certain extent. And this is why in most places, home health aides have to have at least 75 hours of training. And that's to give them that kind of knowledge of how to transfer a patient into a wheelchair without dropping them, or how to walk somebody and what to look for. But home health aides really should have that training. You're right. It is good neighbor stuff, but home health aides still should have that training. CNAs are going to be tested on that training to make sure that they meet those minimum level of competency. And primarily because CNAs are expected to know more. You're certified, right? You have that expectation that you can work at that professional level. Home health aides are not certified. So there's less expectation there. So it's all about that higher standing in the community, that higher wage, and that level of knowledge that's required for that position. Okay. So, Blue says the reason we have to teach ambulating, feeding, and dressing because many home care aides are independent, non-agency affected caregivers and work for agencies. You're right, Blue. A lot of people are independent, and as that home health aide, there's less liability. It's when you get up to the CNA level that you really do have to know a little bit more. So let's see here. Hi, Eunice. Thank you for showing up. We really appreciate it. Blue says we have a wide variety and range of clients. The HCA credential allows family members to care for the loved ones in their own home while making sure they have skills similar to a CNA without making them undergo the full 85-hour CNA course. Well said, Blue. Well said. And there are programs out there in some places that will allow family members to care for affected family members, those that are sick or ill or injured, and in some cases get paid for it. And that's what that would help with as well, because you do have to have some credential for that. Blue says, oh, hi to here. Blue says, and you're right, anyone can emulate anyone, but can you do it properly, safely, without harming yourself and the family member? And absolutely, absolutely. Emanuela, you spoke with so much passion. I love the sincerity in your voice. Thank you, Amelia. I can't, how do I put this? I'm goofy, right? People laugh at me all the time because I do still have a deep passion for what I'm doing. I do still believe in the sanctity of patient care being patient-centered care, and, the emphasis on care, right? And, doing a partial bed bath is one thing, but doing it protecting the dignity and the privacy and the patient's rights and connecting with them on a personal level is something completely different. And I do believe very strongly in what I teach, and I practice it as well. And I think that healthcare could be a much, much, much better place if I could just give a little bit of this to all of you guys out there. And not to say that I'm doing it perfect. That's not what I'm trying to say here, but I am saying that in a lot of places in medicine, we've lost that personal touch. And that's what brought me into nursing to begin with. And I think that's what brought a lot of you into nursing to begin with. And I think that sometimes we just get so caught up in the day-to-day minutia and, oh, who do I have to take care of today? I'm going to clock in, do my job, clock out, go home, resume my life. But if you work in healthcare, this is your life. It's not just something you do between the times you clock in and clock out. And I think that having somebody to fill your bucket of nice is very important. And that's what I'm trying to do with these weekly things, is that just like I want you to go out and fill somebody else's bucket, I'm here to help fill yours. When you feel a little bit down and start to wonder, is it even worth it? Do I even want to do this anymore? And I'm also here to answer your questions as well, because there's a lot of questions out there. So, but thank you. I know I'm a little bit of a geek. I'm sorry. So let's see here. Jennifer says CNAs can work in assisted living. Those aren't nursing skilled facilities. How do CNAs qualify to get required hours to keep their license? Oh, Jennifer, that is an awesome, awesome, awesome question. So the answer is it's state specific. Okay. And this is really, really important for you to understand. So for every single state, there is a work requirement in order to renew. Some states require that you're currently working as a CNA in a CNA capacity in order to renew. Other states require that you work as a CNA at least once in this renewal cycle in order to renew. Every state's a little bit different. You have to check your state requirements, but does assisted living meet that criteria? Because it's assisted living, it's not a nursing facility. So does it meet that criteria? And the answer is it depends on the state. There are some states that do not let you renew your certification unless you're currently working in a skilled nursing facility. So even though you might be a CNA and you might go to work in an assisted living facility, and you don't need your CNA to work at that assisted living facility, when it comes time to renew, you may not be able to renew your CNA certification. So you have to check with your state and figure out what your state is going to require when it comes time to renew. So that's, it can get very, very tricky. Now, other states, they're like, that's fine. As long as you're performing some sort of patient care, we don't care where it's at. We don't care how you're doing it or who you work for, or what your title is, you can renew. Other states are like, nope, 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 that doesn't work for us. You have to work at a skilled nursing facility in order to renew. So you have to find out what your state is going to require. Okay. Eunice says, I finished my training yesterday, waiting for the state exam. Oh, well, good luck. We're super excited for you. Let's see here. Miss Patty, what's the difference between a CNA and a GMA? I know some states have this. Okay, a GMA, that is not a nationally recognized medical credential. Okay, so GMA may mean something different in one state and another. It's not a nationally recognized medical credential. But in most states, that term GMA means graduate medical assistant. They've completed a program. They're not state certified, or I'm sorry, they're not nationally certified. They didn't take a national certification test, which you don't need in a lot of cases, but they did graduate from a medical assistant program. So that just designates that they hold that training. They completed the training. So GMA completed the training. Now, medical assistant is different from nursing assistant. It's right there in the title. Medical assistants help doctors in medical settings, like offices, walk-in clinics, that type of thing. Nursing assistant assists nurses in nursing settings. So anywhere you find a nurse, you can have a CNA. Little bit different modality there. A lot of the skills will cross over. Sure, vital signs cross over. You can have vital signs as a nursing assistant or a medical assistant, but some of the other things that you do will be a little bit different, tailored to the setting you're in. Okay, kind of like the difference between, let me kind of explain this a little bit more. So if you have a mechanic, if I say I'm a mechanic, that tells you that I have some sort of mechanical ability. I probably work with wrenches and filters and, things that have to do with some sort of an engine. But there's a big difference between being a car mechanic, a motorcycle mechanic, an aircraft mechanic, or a mechanic that works on those huge container ships, keeping those engines running. Though, if you have one of those container ship mechanics and you hand them a motorcycle and say, "What's wrong with this?" They're going to go, "Oh, take it to a motorcycle mechanic." I don't know. Sure, they're a mechanic, but they work in a totally different place and they have different skill levels, right? So you have nursing assistants and you have medical assistants, and they're both assistants. They both work in the medical industry, but they're going to do things a little bit different, tailored to where they work. Okay, I hope that helps you. Let's see here. Tanya says, "I enjoy watching your videos. I learned so much for you." Well, thank you, Tanya. I really appreciate that. Let's see here. Blue says, "Jennifer, in Washington State, if you're working as a CNA that's not affiliated, the SEIU 775 union oversees the 12 hours of required continuing education." Yeah, every state's a little bit different, Blue. You're absolutely right. So Queen Stella's Side Attraction says, "Hi, Nurse Patty. I passed my exam here in Dubai." Oh, that's great. Congratulations. "I got 73 over 100. 60 was a cutoff mark. Now I'm preparing my BLS exam next week, Saturday." Well, congratulations to you. That is super exciting. I know you've been with us for a long time. We're super happy for that. Blue says, "If you're affiliated with an agency, the agency is required to make sure you meet those requirements." In other words, in Washington State, depending on who you are employed by, depends on who you do continuing education hours through. Absolutely, Blue. And every state is going to be governed a little bit differently. Let's see here. Noes says, "Good afternoon. Can you help, please? I want to take the test. I know the word, but my English is not well." Oh, I wish I could help you. I really, really do, because we need good caregivers in the industry. Absolutely. The problem is that the test is only given in the skills test is only given in English. So there's nothing I can do to help you with that other than to tell you to really immerse yourself in English to try to get a handle on the speech, the how to portray yourself. We have a lot of people that just watch my videos over and over, memorize what I say, and do that. And that will get you past the test. But the problem is that there's life beyond the test with patients, and you really have to understand what the patient is trying to say to you. So, you're unfortunately, if you're going to work here in America, in the US, you really have to learn English effectively to be able to work on patients. Now, I get it. I get it. I am trying to learn Spanish, and I have it's hard. It is so hard to learn a second language. It's hard. I mean, you can pick up words, sure. I know, pen, I know paper, I know lunch, I know, but it's all those verbs and those tenses, and it's hard. I get it. But the state test, it has that requirement for a reason. So my advice to you is just keep trying. The written test can be taken in either English or Spanish. So if Spanish is better for you, I encourage you to take the test in the language that you're most familiar with. And I wish you a lot of luck, but there's not much I can do to help you on this journey other than be your biggest cheerleader. Okay. Let's see here. Jennifer says, "That makes sense because medical office assistants are trained to answer phones, where really anyone can answer phones." Yeah, Jennifer, you're right, but this is the part nobody really thinks about, right? So anybody can pick up a phone and say, "Thank you for calling Dr. So-and-so's office. My name is Patty. How can I help you?" Right? You can do that. Now, the problem comes is what happens when they tell you what's going on, right? "I just cut my arm off. What do I do?" So you have to have that understanding, or "I need you to refer me to XYZ for a test," or a critical test result just came in. I need to notify the doctor immediately. What do you do? So understanding how to answer phones, yeah, that's, anybody can do that. That's super easy. It's knowing what to do on the next statement. So what is coming through that phone at you that you have to handle immediately? And you can't take the time to sit and think, okay, well, wait a minute. I don't know. Maybe I should interrupt the doctor, but he's doing a procedure. Should I interrupt? I don't know. You can't, you have to have that understanding, that knowledge, that training to know what to do in that situation. So, and that's where that medical assistant is going to come in, because it's going to help you learn processes and procedures to help the doctor, but also learn what to do to make all of that work seamlessly. Okay. Janine says, hi, Miss Patty, is checking the patient's wristband still required in Florida? No, actually it's not. For the test, you will not have a wristband. Nobody's going to be wearing a wristband for you to check. That doesn't happen. You have to identify your patient by name. So that's as simple as saying, hi, Mrs. Jones. If it's not Mrs. Jones, trust me, they'll let you know. They don't want what you've got planned for Mrs. Jones if it's Mrs. Rodriguez. She knows that medicine is not always nice, right? So they're going to let you know. If you don't want to do that, you can ask them, hi, my name is Patty, your CNA. Can I ask your name? And have them state their name to you. Either way is fine for the test, as long as you're identifying them by name. But there will be no wristbands for the state exam. So Jennifer says, a hospital is considered a skilled care facility, correct? No matter what floor you work on. Ooh, this is legal tricky, Jennifer. Legal tricky. The answer is it depends. It depends on what state you work in, because in the majority of states, you do not have to be a CNA to work in a hospital. You can be, and a lot of hospitals will advertise for CNAs to work at the hospital, but strictly legally speaking, you do not have to have a CNA certification to work in direct care at a hospital in most states. I know this is one of those head scratchers. What? That doesn't make sense. I see CNAs at the hospital all the time. And yes, CNAs do work at the hospital, but I'm talking legally, because there's a difference between legal guidelines, what the state statute says, and what employers want. Right? So I may not be required to hire somebody with a master's degree in social media marketing, right? There's no law that says I have to have somebody with a master's degree. But for my business, I may be looking to hire somebody with that degree so that I have a higher level of assurance that they know what they're doing and what their scope of practice is and all of that. So employer requirements are sometimes different than statute requirements. Statute requirements are the minimum. Employer requirements can go above that. And that's why you see CNAs in hospitals quite often. But that doesn't necessarily mean that it's required to work there. So that brings up the whole continuing education thing. Because if it's not required for a CNA to work in that setting, is it going to be allowed as your work requirement for CNA renewal? And that's up to your state. So again, I'm going to push you back to the state for your specific requirements. Okay, I hope that helps. Emanuela says, I have not been able to get a job, so I have not the idea of how it feels, and it feels sad, but I have faith, which I wish I could get a job already. Emanuela, oh man, there are openings everywhere. Everyone is hiring, everyone. Just this week, I have had 5 different employers call me on my phone and say, are you graduating a class out soon? Because we need CNAs. I want to come recruit from your class. Just this week. So yeah, I mean, everybody is hiring. So make sure that you put on your scrubs, dress appropriately, look good, and go out and put applications in. Go to local assisted living facilities, nursing homes, rehabs, walk-in clinics, hospitals, mental health centers, dialysis clinics. I mean, go apply everywhere. I guarantee you will get hired, because there's such a huge need of direct care staff. Queen Stella says, I will need to watch more of your videos to pass my BLS first aid CPR. Oh, Queen, they're going to give you everything you need in the training. I used to do CPR and first aid. Everything you need is in the training. As long as you pay attention and you perform do exactly what they tell you to do, you can't fail. I mean, it really is. It's not a pass fail type of class. It's training. I want you to know what to do. Well, I'll give you a great example of this. Okay. Great example. I wasn't going to bring this up, but I will. So today I go to the dentist and I walked into the waiting room and I had just walked in and I hear a big crash right outside of the door. I turn around and look out the door and there was a major motor vehicle accident right there in front of where I'm standing. I mean, the car flipped over multiple times. Somebody was trapped inside the car. It was a mess. There's another car over here spinning in circles. I'm like, oh, wow. So immediately grab my phone, call 911 as I'm running out to the road. I mean, I'm talking to 911, telling them, oh my gosh, there's a crash right here. Somebody is trapped. I'm going to try to get them out. This is where I'm at. And as I got to the vehicles, there somebody else was running up and I handed them the phone and I said, talk to 911 as I'm helping the driver. Okay. So that's first aid. So notifying 911, because I can't do this by myself. I need help. So notifying 911, attending to the victim to make sure that they're stabilized. Now, in this particular car, gas was actually dripping out of the top of the car. It was upside down. The whole, it was a mess. Oh my gosh, it was horrible. And the guy, we got the guy out, and he was trying to get back in the car to get his registration, and there's stuff everywhere. And I was like, no, I'm sorry, you're in shock. You need to sit right here. You cannot go back to that car because there's gas leaking and I don't know if it's going to blow up. Right. So my job is to keep that person stationary until somebody more advanced gets there and can assess the situation. So that is, in a nutshell, first aid. Now, if I had noticed during this event that this person did not have a heartbeat, right? I mean, thankfully he was okay. It was a young man. He was okay, shaken up, banged up, bruised up, cut up, but he was okay. But if it had not gone that way, right? If it were very serious and his heart had stopped, then I am prepared to do CPR until somebody comes that can help him. So that's what CPR and first aid is all about. It's about knowing you have to call 911 to get help. You have to know what to do, assess the situation. It was an unsafe scene, so I got to get the guy out. I got to make sure he doesn't go back because he's in shock. I know his brain is not working. He was just in a wreck. I got to get him to sit here and be calm and wait for somebody to come. And I can attend to any emergencies that happen until the other people get here. So that's CPR and first aid in a nutshell. And that's what they're going to teach you in class. I just gave you a whole 4-hour class in like 2 minutes. Okay. Jennifer says, so is continuing education required to keep your license if you're also working or only working? Okay. So Jennifer, most states, again, this is a state specific, and I've got to stress that. Every state is different, but in most states, you have to have a work requirement and continuing education. There are some that don't require continuing education. There are some that don't have a work requirement, but no, I'm sorry, that's not right. Everybody has a work requirement, but there are some that don't have continuing education. So go with your state's guidelines. Okay. Blue says, speaking of Spanish, my Spanish neighbor learned a lot of English watching Sesame Street and The Office. Oh no. Yeah, we've been watching Office reruns, man. That show. But yes, and I actually learning Spanish. I'm actually watching a lot of Spanish children's programs to try to improve my vocabulary and my understanding, my comprehension of what's being said. And that's a great suggestion, Blue. Tiffany says, I learned to speak French watching Sesame Street. Yes. Blue says, Miss Patty, checking on the wristband. What if a patient doesn't remember their name, or am I overthinking the Florida State test? Yes. Blue, you are overthinking the Florida State test. The scenarios are set in stone. They never ever change. They're the exact same 11 scenarios, and your patient is competent and able to state their name or able to respond to their name. So that does not change in Florida. Now, in a clinical setting, we have a process in place. Remember, when a patient comes in, they get assessed by the nurse, head to toe, all real problems and all potential problems. So, not being able to state their name or not being able to respond to their name is a potential problem that has to be addressed on the care plan. How are we going to identify this patient for any and all care procedures or anything else? So, something in the care plan would notify you of how the identification of that patient would occur. The process is already in place. Remember that care plan is what drives everything for CNAs. If it's not in the care plan, you can't do it. If you have a patient who is has had a stroke, is nonverbal, can't respond, and there's nothing in the care plan about how to identify them, then you need to be going to the nurse saying, "Hey, how do I know this is the right patient? How do I identify this person?" And let the nurse instruct you on what to do. Okay. So that care plan, man, that care plan is the key to everything. But for Florida, everything is easy. They're able to respond. Okay. Jennifer says, I'm okay. I'm Oregon. You have to be licensed to work at a hospital, CNA 2 level. Okay. Yeah, and that is probably the I don't know the statute requirements for Oregon. Have no idea. Haven't researched it, so I can't give you any indication on that. What you may believe is a state requirement may actually be an employer requirement. I don't know because I haven't done the research. A lot of people have that misconception, but there are a few states, there are a few that do require CNA certification to work in a hospital. Because I don't know, I really can't weigh in on that. Blue says, Emanuela, honestly, to goodness, as long as you can pass a background check and have a valid CNA license, it's not hard to find a job. Yeah, right now everybody's hiring, absolutely. Now, if you have a language barrier, that can impede you a little bit. But if you are living in an area that has a high concentration of people that speak your language, go to those facilities because they have patients that speak your language, right? So they probably need CNAs to be good interpreters. So true, Blue. I'm not going to read that, but very true. And Queen says that, wow, thank you so much for the teaching. You're very welcome. All right, guys. I need to end today, but I do want to end with just some good thoughts and some good vibes to the people of Ukraine. And, my heart just breaks for them. And if you don't know what's happening, turn on a TV. And this is going to have wide-reaching implications on us here in America as well. So just, it's absolutely awful. It's just, one country being invaded by another. And I don't know what the end goal is here. It will end in loss of life, which is tragic and horrible and makes my heart sick. But it is a good lesson for us that we really need to be strong in our caregiving skills, because you never know when those caregiving skills are going to be needed, even in your own community, even in a time when you don't think that that you are going to be useful. So I think everybody should have good caregiving skills. And remember your bucket of nice. When your bucket of nice runs empty, then Putin's a good example of what can happen. You end up being a tyrant and trying to take over other countries, right? So make sure you're filling up somebody's bucket of nice so that we can prevent future tyrants from coming to power. All right, guys. So with that, I'm going to end today's lesson. And until next time, guys, fill up somebody's bucket of ice and happy caregiving. Bye.